Hello, everyone. Thank you for joining us today at our first virtual reality naloxone training simulation. My name is Reiko Mendoza, and I am Vice President at CADCA. As many of you know, we are thrilled to partner with Walmart to present this unique training experience to all of you. We initially launched this simulation back in February at our National Leadership Forum, where many of you were part of that. And we engaged with you all to learn how you can host an event using this technology in your community. Just as we were starting, we all know what happened. And so now we are on to the word of 2020, which is pivoting. So because you're all so amazing and adaptable, we've decided to move to a virtual training event. And we are thankful to our amazing team and good friends here at Cecil County for being our first fearless hosts. So before I kick this off to our speakers, I want to let everyone know the goals for today. First, we want to hear from you all how you would use this format in your communities and what suggestions you have to make this virtual format even better. Second, we want to know what events and audiences do you have in your community where you can use this VR technology to either build an event around or enhance the work that you're already doing. And lastly, our goal is to work with you all in this cohort to each host an event in your community and then take this to scale nationally. In doing so, when we roll this out, we want to create resources to go along with this, including a toolkit and valuable information on who to invite, potential speakers to engage with, social media engagement, etc. So we're really looking for your valuable input. After we hear from our speakers and see the simulation, we'll have a couple of questions of guided Q&A. I'll ask a few questions at the end, and please type your answers into chat, or you can also raise your hand, whatever you're comfortable with, and we'll call on some of you. Additionally, in the weeks to come, we're going to reach out to you all as a group to get more input as well, and you always know where to reach us at CADCA with any of your ideas, suggestions, complaints, etc. So on to our speakers. The first one we're going to start with is CADCA's new president and CEO, and my boss, General Barry Price. General Price joined us at CADCA 4 years ago as our Executive Vice President and Chief Operating Officer. And September 1st, he was named President and CEO, and we are excited to hear from him today. And so I turn it over to you, sir.
Thank you very much, Reiko, and I'm excited to be here to join Drug-Free Cecil today for this training and this virtual reality demonstration on how to save a life by reversing the effects of opioid overdose. As Reiko mentioned, Drug-Free Cecil County's coordinator, Virtual Boysaw, is a great friend of CADCA and currently serves on our Coalition Advisory Council. And a special thank you to everyone on today's webinar. We hope this unique virtual event will train you on how local agencies are collaborating to combat the opioid epidemic in our communities. CADCA was founded in 1992 as a recommendation from the President's Drug Advisory Council. CADCA's mission is to strengthen the capacity of community coalitions to create and maintain and safe, healthy and drug-free communities globally. CADCA represents more than 5,000 community coalitions nationally and has worked in more than 30 countries around the world. There are 59 substance use and misuse prevention coalitions within the state of Maryland, 18 of which are CADCA members. Some of these coalitions are on the webinar right now. Thank you all, and thank you for joining today's discussion. Prevention of substance use and misuse before it starts is the most cost-effective and cost-efficient way to reduce substance misuse and its cost. $1 invested in prevention saves communities an average of $2 to $20. Our partnership with corporate and federal organizations supports the work in our communities, such as your own. Our partner, Walmart, has developed a virtual reality tool to deliver a powerful experiential element to naloxone and overdose reversal trainings. It has never been more important to know how to save a life, and our coalitions are at the forefront of our efforts in communities and are making a tremendous impact. During the COVID-19 pandemic, many Americans are facing experiences of heightened stress and anxiety, as well as physical and social distancing, and our work to prevent substance use and misuse becomes even more important. It is also important for trainings and conversations like these today to occur so that we reduce the stigma of having a substance use disorder. Over the several last months, our coalitions are beginning to see an increase in substance use disorders because of COVID. Due to COVID distancing practices, people are not able to assess their doctor to act or recovery and treatment resources as needed. This is why our partnership with Walmart is aiming to help community coalitions sustain and thrive virtually during this uncertain time, nationally and internationally. Given that CACA has been able to maintain and even increase engagement with our coalitions during this pandemic, there is an opportunity to further develop a strategic training such as this one today and evidence-based recommendations for our coalitions through virtual platforms, which will help address the increasing risk of opioid misuse during this time. I am now going to pass it back over to Reiko, and I thank you for having me on today, and I look forward to your questions.
Thank you, General Price. And now it's my pleasure to introduce you to Virgil, our friend, coordinator for Drug-Free Cecil County Health Department, who works on comprehensive substance abuse prevention efforts, longtime member of CADCA's Coalition Advisory Committee, and all-around amazing person. Welcome, Virgil.
Thank you, Reiko. But before I get started, I'd like to take this time to thank Walmart, who's sponsoring this great opportunity. I'd like to thank the Communities Anti-Drug Coalitions of America for the great leadership and inspiration to coalitions throughout the United States as well as international. I'd like to thank the Drug-Free Cecil Coalition for collaborating their collaborative efforts as well as advancing the vision. And last but not least, I'd like to thank our Drug-Free Cecil Youth Coalition for just being simply amazing. But before I get started with our efforts, our accomplishments, as well as our data outcomes, I'd like to just take a moment just to let everyone know what prevention is. First of all, there's three things about prevention. Number one, prevention is a process and not an event. Prevention seeks to change local conditions. And thirdly, prevention promotes well-being. So on to our prevention efforts. I wish I had time to unpackage that, but only have a few times. Our prevention efforts really all centers under the 7 strategic strategies that affect community change. So these are our toolbox in prevention here in Cecil County that we do prevention business. The first tool in our toolbox is called providing information. So our efforts here in Cecil County is that we provide PSAs and billboards from our youth and coalition meetings to plan for activities and events in the future. Very heavy in social media and presentations to raise awareness. This is vital so it engages our youth and it let the community know that Drug-Free Cecil is here to be a partner. Secondly, we like to look at that toolbox called enhancing skills. Well, our partners in CACA and our youth leadership for CACA Forum and CACA Mid-Year, we do get a lot of opportunities to build our capacity so that we can follow the trends of prevention and substance abuse, as well as have increased plans in terms of doing prevention better here in Cecil County. Thirdly, we have the toolbox called providing support. Well, providing support, what we do here in Cecil County, we provide opportunities for our partners to come together and collaborate to reduce substance abuse among our youth. And it also provides opportunities for all of us together to reduce risk factors and increase protective factors. The fourth toolbox is the enhance access and reduce barriers tool. Now, what we do there with our partnerships with Raleigh, Maryland RX, as well as our partnerships with the DEA and other organizations within Cecil for the take back and distribute Deterra, these are great barriers to reduce the substance abuse and reduce being able to get rid of their prescription drugs. And lastly, we have change consequences. Well, here we support our law enforcement that enforces the alcohol laws and compliance checks and over-service training. So these are things that our youth are engaged, our partners in prevention are engaged with, and we all be able to come together and make an impact on our outcomes here in the county. Now, our prevention achievements. Well, we have several achievements, and but I will start just with a few. Because of our work here in prevention and the great training and the great collaborative efforts here, we won the Harlan Graff Award in our recognitions of our efforts in supporting health education and quality and safety in the community. This was given to us by Union Hospital, but now it's called by a different name. We also received the NCAD Maryland Award in appreciation for outstanding service from Recovery Centers of America. We also received an award from the Baltimore Ravens and the Governor's Office of Service that was presented to us by M&T Bank for the Ravens Honor Roll Award. In addition, we were blessed enough to receive the Dose of Prevention Award that was sponsored by the Consumer Healthcare Products Association. And we also recently, in our take back last year, we received the presidential proclamation for many of our coalition partners from the President of the United States. And lastly, we just received a shout out from First Lady Melania Trump for our recognition for our youth and their work during COVID-19 by distributing the terror bags along with food distribution. So we have a lot to be proud of with our work here in Cecil County. But as our results, we take a look at our core measures, and I would just want to just highlight our 30-day use for 2018 in our alcohol, tobacco, marijuana, and prescription drug use. All of those went down because of the tremendous efforts from all of our partners, from our youth, from our coalition, from all the different sectors that have come together, and particularly the schools, the health department, as well as our youth and our youth serving agencies. And when we have understood that when people come together and work together, there's nothing we can't achieve. Thank you very much.
Thank you so much, Virgil. Next up is Mr. Kenneth Collins. Mr. Collins is Director of the Division of Addiction Services at the Cecil County Department of Health. He'll talk to us about the achievements they are making in their community and some of the challenges and successes regarding stigma and naloxone awareness and overdose prevention efforts. Thank you, Ken. So I think you have to unmute. There you go.
Am I good now? Okay. New technology. Hey, it's so encouraging to hear all the great accomplishments within prevention, within primary prevention. And I think there are a lot of good accomplishments across all 4 pillars in Cecil County, which include prevention, treatment, recovery, support, and public safety. I was asked to speak a little bit about data. So let me just summarize that according to data from the Cecil County Sheriff's Office, it's notable that since January 1st all the way through today, there have been 471 overdose incidents. Of those 471 overdose incidents, a provisional total of 78 were fatal. Again, according to our local data, during the last 10 months, there have been 78 individuals who've died from a drug overdose. Now, these aren't just numbers. You know, each death has a name. These are fathers, these are mothers, brothers, sisters. You know, these are sons, daughters, our neighbors, our coworkers. All of us have known someone who has struggled with addiction, who have died from overdose. You know, this affects everyone. That's why today is so important. You know, addiction is not a faraway problem. It's here, and we can all help. And nothing important gets done without collaborations. We are all, and we can all be part of the solution. So as Virgil said, and as all the other speakers have said, we sincerely appreciate the collaborations with Walmart, with CATCA, with the Drug Free Cecil Coalition, for helping us expand the conversation regarding overdose prevention. Today's event, this opportunity, you know, is helping us to increase awareness about Narcan, and about the availability of overdose response training. It's helping us decrease the negative stigma associated with substance use disorders, because we know that that stigma is the greatest obstacle to treatment. And thirdly, and most importantly, today's event, this opportunity, is really it's about sending the message that these lives matter, and they do. In Cecil County, we provide no-cost training on how to recognize and respond to overdose. And with that training, we distribute Narcan. During the calendar year 2019, 2,982 individuals were trained on how to recognize and respond to overdose, including how to administer Narcan. So last calendar year, based on a state formula, Cecil County had a Narcan saturation rate that was the second highest in all of Maryland. And that's a really great accomplishment. We're really proud of this. We're doing a good job getting Narcan out into the community, and we're saving lives. And we can do more. And again, that's why we're so appreciative today. This virtual platform, this new opportunity, is a new tool to help us expand our education. I do want to do a shout out here for our overdose response training on the backside. If there's anyone is looking for additional information, please contact the health department, our overdose response coordinator, Miriam Alvarez. Her number is 443-245-3785. Training is available at no cost. In addition, I think it's really important to say that we're working really hard to connect individuals to treatment. You know, treatment saves lives, and treatment is available. For help with access to care, please contact the CATCH project. And CATCH is an acronym for the Cecil Addiction Treatment Coordination Hotline. Anyone can speak to a peer recovery specialist 24 hours a day, 7 days a week. You know, this number is serving as an access point for people to gain access to care. The CATCH phone number is 443-245-3257. This is a newer program. We've just gone 24/7 on September 1st. And it's really, really encouraging that in the last 8 weeks with the CATCH project, we've responded to 348 calls. We've connected 122 individuals to residential treatment and 79 to community-based treatment. Again, CATCH is 443-245-3257. For more information about everything we're doing, all the good efforts that are going on in Cecil, and also to find the CATCH phone number, please go to the Cecil County go-to website, which is rewriteyourscript.org. And I would like to remind everybody that the CATCH phone number is on that website, top right-hand corner. Again, a lot of good things. I'm really proud to be here. Really, it's a great opportunity. And again, these lives are worth saving. Thank you for including us, and thank you for helping Cecil be part of this pilot project. Thank you.
Ken, thank you so much for joining us. You guys are just doing such incredible work, and we really cannot tell you how much we appreciate your time and you all being part of this. Thank you. For our last speaker, we are going to hear from Jessica Buranin. Ms. Buranin is an addiction counselor and person in long-term recovery who will talk about the role of naloxone in the path to recovery. We really appreciate this point of view, and I will turn it over to you.
Hi everyone, my name is Jess and I am a person in long-term recovery. What that means to me is that I have not had a drink or a drug since November 1st, 2013. From a very young age, I was affected by drugs and alcohol. Both my mother and my father struggled. At 18 years old, I was prescribed opiate pain medication, which led me down a dark and scary road. 2012, I went to treatment. I got out of treatment. I left treatment AMA, which is against medical advice. And I wound up using when I got out. And I woke up in the hospital, restrained to a bed. I woke up scared and angry. And that day is the day that I was administered Narcan. And that wasn't the end for me. I continued to use from there on out, but that day allowed me to be who I am today and to accomplish the things that I've accomplished in my life today. November 1st, 2013, like I shared earlier, that's my clean date. That's the day I decided to stop using. but if it wasn't for that Narcan, I would not be here today. Today, I am a student. I will graduate with my master's degree in social work in 2 months, a month and a half. I am an addictions counselor, and I am able to help people who are also struggling with drugs and alcohol. And I'm also a mother and a sister, and I'm able to show up today. But had it not been for that Narcan, I wouldn't be here. A month prior to my experience with Narcan, I lost my mother to an overdose. So I know what that pain is like to lose a loved one to that. And I'm very grateful that my children didn't have to go through that pain, and that I can show up today and be here every day. Thank you guys so much for having me. That's all I have.
Jessica, thank you. And congratulations to you on your recovery. Congratulations on your master's degree. And thank you so much for coming here and just being part of this and giving us your point of view and letting us know your story. And it's just really powerful and unbelievably helpful. So thank you for that. So thank you to all of the speakers here who've taken time out to be part of this event. We are going to now pass it on to the virtual reality part of our training. Sorry. Okay, go ahead.
All right. So for people that haven't seen this before, what you're going to see with virtual reality is what Anne here, our participant, is actually going to see. She's going to look around the room. Now she knows to move a little bit slower. That way it doesn't give anybody that sea, like being out on the sea, we don't want anybody seasick. But you're in a what's called live fire. You can turn around 360 degrees. It's interactive. There's going to be some times throughout that there's going to be some boxes popping up. For people that are joining us on Zoom, you are not going to be able to read what's on those boxes. It just doesn't go through properly with the technology we have right now. So I will read those, and then Anne will make her selection. But if you guys want to follow along with us, so give us just 1 second to get set up. Does it sound good for everybody? Yeah. You're good. So it says, powered by Walmart, working together to fight the opioid crisis. For more information, you can visit walmart.com/opioids. It says, welcome, take a minute to look up, down, and all around you. This experience contains depictions of drug use and simulations of drug overdose. It may not be suitable for all audiences. If you'd like to still view this experience, select OK to begin.
It's what I just went to my grandma.
What? People get strung out on this stuff?
Yeah, that's the point.
These two industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Correct. Over 70,000 people died of opioid overdose in the United States in 2017, and millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has. But not every overdose needs to end in death. Today, we're going to teach you to spot the signs of an overdose and administer naloxone, a life-saving medication.
Hey. You ready? Oh, what's up?
Pale or clammy skin.
Opioid overdoses will slow or stop your breathing. This reduces the amount of oxygen in your body, resulting in pale or clammy skin.
Pinpoint pupils.
The pupils will constrict until they are the size of a pin.
Blue fingertips.
The lack of oxygen can cause the fingers and sometimes lips to turn blue, gray, or purple, depending on the person's skin tone.
Breathing is weird. It's too slow.
Slow breathing.
A very serious side effect of opioids is depressed breathing. During an overdose, their breathing will become shallow, erratic, or stop entirely.
Jay, wake up, man. Wake up or I'm calling the cops. John, hey, I'm not playing with you. Are you breathing? Dude, you're not breathing. Jonathan.
Loss of consciousness.
Loss of consciousness is the final tell of an overdose. If you suspect someone is passing out because of an overdose, you should scream their name and try to wake them to see if they will respond. As with any emergency, the first thing you should do is call 911.
Hello. I need help.
Naloxone is a life-saving medication that can reverse opioid overdose and restore breathing. There are several types of naloxone available, and all of them provide a life-saving medication in the event of an opioid overdose. In the example today, you will see the nasal spray Narcan administered. If you happen to have the injectable form, make sure to hold the needle straight and inject it into a muscle, like the shoulder or the upper thigh. First, peel back the packaging to remove the device. The device has a plunger and a nozzle. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Be careful not to accidentally spray the naloxone before you're ready. The device only has 1 dose, so don't test it out. Put the device right up their nostril until your fingers are touching their nose. Press firmly on the plunger to release the dose of naloxone.
Wake up. Come on, man, wake up.
After you administer naloxone, place them in the recovery position and wait for help. The person who overdosed needs immediate medical care. You should stay with them until help arrives in case they lose consciousness again. Another dose may be necessary.
All right, that's it. Welcome back.
Great job. When people think of overdose, they usually think of recreational opioid use like we saw here. This is a stereotype, and unfortunately, there are many situations that lead to accidental overdose. Let's take a look at other situations that can lead to accidental overdose.
Mom? 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 Mom, wake up. Mom? Again? My mother is blacked out. I think she's had a heart attack. Send an ambulance.
Please stay calm. We're going to check her vitals. What's her name?
Blanche.
Blanche, I'm here to help you, okay? Is that hers? Can I check her for an overdose? She's got a pulse, but her breathing is slow. Let's check her pupils. All right, stay with me. Uh-oh, they're constricted. With this medication, this may be an overdose. Let's administer naloxone. All right, Blanche, stick with me, okay? 1 second. All right, I'm just gonna go right up here. The patient took too much of her prescribed medication. She forgot that she took her medication before breakfast and took another dose after breakfast. In the event that this had been a heart attack, naloxone wouldn't have been able to treat the heart attack, but it would generally be fine to administer to her without serious complications. Talk to your healthcare provider or check the package insert for possible side effects and additional information. All right, Eugene, got your stuff. No. Eugene took an old opioid medication that he had previously been prescribed for pain. Usually this wouldn't cause an overdose, but he's taking a new benzodiazepine medication. When opioids and benzodiazepines mix, the results can be deadly. Always check with your doctor or pharmacist before taking any medication, just in case there will be a negative interaction with your other medications. Opioid overdose can happen to anyone. You can overdose from opioids even when taking a prescription exactly as your doctor prescribed, which is exactly what happened to me.
All right, hotshot. I hope you're paying attention. It's your time to shine. Select the things you should look for when you suspect an opioid overdose.
Pale face and white pupils. That's slow for breathing. Fingers.
Now, let's review how to administer naloxone.
So it says, what's the first thing you do to administer naloxone? Shake the device vigorously, clear the patient's nose, or peel back the packaging.
Correct. You have to remove the device from its packaging. It will not do you a lot of good otherwise.
What's the second step to administering naloxone? Thumb on the nozzle, remove the cap of the device, or thumb on the plunger.
Correct. That's how you hold the device.
What is the last step to administering naloxone? Insert device in the nostril, insert device under tongue, or push the plunger to administer.
That's correct. You did it. You saved my life. Thank you for knowing what to do in the event of an opioid overdose. Accidental overdose can happen to anyone taking opioids, whether recreationally or even as directed by a doctor.
This information can save a life. Opioid misuse is a national epidemic, and accidental overdose can happen to anyone taking opioids. It takes an entire community to keep all our members safe from overdose. If you or someone you care about is taking opioids for any reason, consider getting naloxone at your local pharmacy and keeping it on you at all times. No prescription is required, and it could save your life or the life of someone you care about.
Great. So we took a look at that, and I think we're going to take just a little bit of time. We got about 15 more minutes, and we're going to just do some Q&A. We have a couple options that we can do this. We can we're going to be monitoring the chat, and we're going to be going back and making sure that we answer all of your questions and take all of your feedback. So if you want to use chat, that's great. You can also raise your hand on Q&A, and I'll just kind of jog back and forth between the two, and we'll take you off of speaker. But before we do that, we really just want to say thank you so much to all of the speakers here today who have taken time out to be part of this event. And for all of you who took time out to take a look at this and really just tell us what you think about this and how you would use this. So I will just go ahead and kind of pose the first question, and hopefully we'll just get some discussion how we can here virtually. So one of the things we really wanted to know is what kind of populations and other community groups do you think would benefit from this technology, either to enhance trainings that you all are already doing, because I know you're all doing such amazing stuff. Can you use this to enhance some of that, or build on trainings or community events that are going on that you could use this? And again, I'll read the responses that I'm getting in chat, or you can do Q&A, either one. Okay. Oh, I think I have a hand. There we go. Is it Martine?
Yes, hi, how are you?
Hey, how are you?
Great. I'm calling, I'm actually a program manager at Baltimore County Department of Health, the local addiction authority. So actually I am one of the managers in charge of our Narcan training. So I would say this is probably going to be a useful tool for the college students. We have received a lot of inquiries from college professors inquiring about naloxone trainings for their students as part of the curriculum. I know there's been some requests from the universities to make that sort of requirement for certain fields that the students get trained. So I think this will be a good tool to utilize with that population because it's pretty, simple, and younger college age students are into that virtual reality, social media. So I think it will appeal to them.
Yeah, I love that. I think that's a great point. And, we have somebody in the chat that's saying this as well. They're saying, I agree. I think this is well suited to be used with younger audience. I think this would be useful in the DARE programs within schools, definitely useful at the high school level. So we have a lot between chat, for high school. What are some other populations? Anybody else have some other kind of populations that they think this would be great for the community or helpful, or some events that you might have going on that you can think of how to use this? Is it Kaymisha?
Yes,
Hi, Kaymisha, how are you?
I am well.
Good, thanks so much for joining.
No problem. I represent Howard County Health Department in Maryland. And I do agree that it's also the younger population, but since you're looking for more specific, maybe juveniles on detention or need to complete whatever requirement they have, maybe this could be something that they'll be interested in because it's sort of very interactive.
I love that. Yeah, that's super helpful. We're getting some of that in the chat too. Somebody has, I think it's Jackie, can this be used at an outdoor event? And I think that is a pretty great question, especially considering the environment that we're in right now, right? So we'd love if somebody has some feedback about that. I mean, I have some thoughts about drive-ins, some, local drive-ins are open right now, and some of you guys are partnering to do things in your community. So, I mean, off the top of my head, that's an idea that I'm thinking about. I don't know if anybody else has some thoughts about that. Oh, I got 2 attendees with their hands up. Okay. Is that Mike? We're unmuting you, Mike. Go ahead.
Hi, good evening. Thank you for this. I think I totally agree with this appealing to younger audiences. I think there's also a really valuable opportunity here that this VR experience, and especially having Walmart's stamp on this, might allow us to access more of the general public. There's folks who aren't either as directly affected by substance use disorder, maybe hold some misconceptions around this, and really help us fight that stigma that we experience way too frequently. If this is something that could be done at events, and again with Walmart's name attached to it, might open it up to a whole different audience.
That's great. Thank you for that feedback. Okay, Kaymisha, can we?
Yeah, just a quick,
Hi.
Hello, just a quick insertion. I wanted to know, to what level do you think you would want to take this virtual reality? Would it be part of like video games or something that people can purchase, or more prevention type side?
Yeah, I think for right now, we're kind of starting, right? The goal is we started with this event. we want to work with all of you to host events like this in your community. And I think we're starting there. And from there, I mean, the goal really is to roll this out nationally. And then, I mean, I never say never. I never say never. We don't know. You know, we don't know what we could do. But, you know, that's a good point. You know, like PSA before events like that, I think is what you're kind of thinking ahead of time. I think that's what where you're kind of going with it, is it?
Yes, and even just having it like video games in, I mean, you know, Walmart is a huge corporation. You know, a lot of people shop there. So maybe if they want to have it like a video game, maybe their child might want to have a video game night where they play this game, you know, or show it in their home or something. I don't know.
Yeah, I got some in the chat, scout meetings. The gaming community is a great place to roll this out. And then I have Dottie, I was thinking the same thing. So the gaming community, I think that's a great idea. Okay, so again, you know, we're gonna leave our information in you monitors and waiting rooms. This is all really great feedback. Okay, Janet from Howard County Health Department, are you planning to implement this in other language like Spanish or Korean? It's a great question. Should be part of CPR and first aid training. Yes. I mean, you guys have the best ideas, seriously. So I'm just going to move us to another quick question, but we're going to follow up with all of you for all of this info. So, and you always know where to reach us at CADCA. So please just, you know, send us these ideas anytime. I'll give you my information at the end of this. And, you know, my team is just really excited about all the great ideas you guys have. So another quick question, and maybe you sort of answered some of this, but what are some local events and campaigns that you might have coming up or that are in the community that you might be planning where this can be beneficial? And when you answer this, you know, when we're thinking right about what our goal is, which is long-term and to roll this out nationally, at some point, hopefully, you know, we're going to be able to have in-person events again. So I guess what we would love right now is your ideas for all of these scenarios. So whatever the life is dictating us at the moment, you know, what are some events that it's going to be virtual? What are some that maybe are going to be hybrid? And then looking ahead, what are some great uses in person? So we just love those ideas. So again, you know, hands, chat. So I'll say county fair next July, of course, depending on COVID. Yeah, I actually know that a lot of our coalitions use their county fairs, or I don't want to say use, but partner at the county fairs and do a lot of work. So I just think that those are great ideas. PTA meetings, parents don't believe it can happen to their kids, but this should save their own kids' lives. I mean, school events, especially when parents are involved, back to school nights and similar. Yeah, I'm gonna go to see if anybody has their hand up. Kaymisha, can we unmute you again? There, oh, there
I didn't mean to put my hands up, but I was going to say parent workshops.
Parent workshops.
Like, you know, workshop that teach parents how to reduce their children risk of drug use or something like that.
Yeah. I think that's great. Church events, all of our coalitions, you know, we're very connected to the faith community. I think church events is really something that we would think about. Good. Anything else? We just had our prescription take back day here in PG County. Good. Thoughts about those events? These are things to tack around to those events and people to invite. I think that's great. We did too in Howard. Can you roll this out in New Jersey? Yes, Joseph, we will. The answer is yes. And we are hoping very soon. This is our first step in you know, rolling it out. So we're going to look to New Jersey. The answer is yes, hopefully soon. So we have that in mind. Okay, let me see what else is in Q&A. Anything in there? Okay. My Family Matters. So Jackie, you have a program. My Family Matters was an in-person program, 2 different schools on a monthly basis. Okay, My Family Matters. So we're definitely going to follow up with you to learn about that program and see, you know, what the equivalent is of that is in other communities too. That's great. Implemented by the YES agency. Okay, thank you. So here's a question, Betsy Fair. Do you think this might have the opposite effect? I don't have to worry about dying from overdose because naloxone will come to the rescue. So, you know, we at CADCA, unfortunately, I was at one of our national leadership forums or mid-year, and we heard this heartbreaking story about someone in the community had said that they had heard, I think, from their local pharmacist who said a young man came in and asked for naloxone or purchased it, and said, you know, he was getting it because it was his birthday that weekend. And so, you know, he planned to have a great time. So, you know, we don't want it to have that effect. And no, I think it's a fair question. But again, you know, heartbreakingly, why, you know, we're trying to be prepared and learn as much as we can and increase as much of awareness. So again, fair question and something for us to be thinking about. So we have about 6 minutes left, so I want to get to one more question. We talked a lot, right, about our plan to roll this out nationally and how we can make this sort of virtual events like this even better. And we also talked a lot about creating this resource. So if we're going to roll something out virtually, we really want to give people the tools, everything they need, like a guide, you know, sort of like the 101, and then you all do the amazing things that you do and customize it according to what's going on in your community. But we want to have this resource. And we want the resource to address exactly what we were saying a little bit early, what the times are dictating to us. So we want this resource to address options for holding events virtually, holding them hybrid, holding them in person, so we can kind of adjust and adapt as we need to. So we have some thoughts about this resource and what should be in it. And a lot of these suggestions have come from you guys because you just have such great ideas. But in there, we know we want to have speaker suggestions, who to invite. I mean, like this speaker panel, I think was incredible. But do we have other suggestions, additional suggestions? Your local legislator maybe to be a part of this, or someone from the faith community or from the school. I mean, whoever we really want those suggestions. We know we're going to eventually roll in because part of any sort of national rollout or even local rollout really is social media awareness, building that awareness. So we want to have, really sort of press releases and messaging and, how you can help brand on that. Other groups to invite, a script for the moderator. So if you're going to host this, you have an easy to follow script. We know we're going to put that in there. And then, one thing that we talked about a lot today is, when hosting this, we probably want to start at the beginning and address stigma and spend some time doing that. And we know we talked about that a lot today too. So we want to have that in the resource as well. So what else? What else should we have? What other suggestions? Small business in the community. All backgrounds, everybody plays a role. A faith leader will be impactful. Great ideas. Okay.
Hey, Reiko, can I offer a comment?
invite survivors to give testimonials. Sure. General Price, please go ahead.
Yeah, and that was the point that I was gonna make. You know, the whole tenor of today's training and episode was improved by Jessica sharing with us earlier. You know, the unfortunate piece about substance use disorder is that oftentimes people have a face associated with it, or a type, or a look. And you know, and I tell you that Jessica, that was a very powerful testimonial today, and I tell you that it made this event better because Jessica was here. And so, Jessica, thank you for sharing with us today.
And Jessica, you have in our chat, someone else has said you have a powerful message, and we should have someone who can talk about their experience by being helped, and that you also help with destigmatizing. So thank you for that. Upcoming events, point in time count, event stays were homeless service providers. I agree, Jessica's testimonial made it real. Overdose survivors be excellent ambassadors. Thank you. Train in shelters. These are really fantastic ideas. Okay, so we are at the hour, and so before we wrap up, I just once again wanted to do just such a shout out to the team here at Walmart who has really helped us put this on. All of these amazing partners here at Cecil County for helping us, all of you who have joined this to just help us really kind of keep growing as we go forward and to do this better and better. Jen, thank you. Thanks for this opportunity. Cecil County is doing great things. Yes, they are. And thank you for attending. So my name is Reiko Mendoza at CADCA. You can reach me at rmendoza@cadca.org. I know you all know everybody on my team. Reach out to any of us. We love your feedback. We love that you guys are part of this. We're so excited about, you know, what we can do with this along from partnering with you. And I will be talking to you soon. Thank you so much, everyone.